It's, yeah, no opening statement, just here to take your questions and try to answer them the best of my ability. So good afternoon, everybody. Cases are up across the country. Testing is also up across the country. So part of that case count is the number of cases that are being measured through additional testing. The CDC has recommended that states test at least 2% of their population every month. North Carolina Department of Health and Human Services has recommended and encouraged us to try to test as much as 5% of our population every month, and we are working on that, and then we'll soon be standing up some testing sites to help with that. So there is increased testing. Certainly, depending on where you are in the country, there's more movement of people. And remember, the stay-at-home order was really about cutting down the height of the wave. It never was about reducing the total number of people who would get sick. It might have done a little bit of that, but it also spread out the people who would get sick over time. So instead of having this huge tall wave, we have kind of a short fat wave. Or instead of having a flash fire, we have more of a slow burn. And really, from the standpoint of keeping our healthcare system from being overwhelmed, that's sort of what we want. So while there's more cases, there are also more recoveries too. And we can talk about that at some point if you want.
Right, so when it comes to South Carolina and Texas and these, over 20 states now that are seeing surges, do you have a fear that Eastern North Carolina could, be seeing the same thing? And if so, in the future or in the next week or so, are we equipped to handle that surge?
I think, as we move around, we will continue to see cases. Yes, if you look at it as a rolling average, our numbers are up. Our numbers are also up because there's been some defined outbreaks in local nursing facilities, and that is added to it. When you look at it on a day-to-day basis, if you take out the big testing spikes for the days that we tested the nursing home folks, our day-to-day testing looks about the same. So I think the burden of disease in Pitt County has been about the same. Our testing, when we look at our percentage of testing positive, the raw number is about 16%, which has been flat. If you correct that for the negatives we think we're not getting, it's about 8%. North Carolina, the state is saying our Pitt County rate of positivity is 5% because they have access to some of the negatives that we don't. So their denominator is a little bit bigger. So I think the burden of disease in the community is about the same, even though our case counts continue to go up. When I did the recovered count on Monday, we had 419 people recovered Monday. So if you look at today, we have 591 cases. Take those 419 recoveries out, we have about 172 active cases in the county. The hospital system, and again, I don't speak for Vidant, but it was in the news this morning, they had 44 people across all 10 hospitals as of yesterday. So I think there's capacity in our system. I think we're seeing disease occur at a rate that will allow us to ride this out without overwhelming our health system.
Awesome. And it's summertime. We're right in the middle of it right now. And with vacationing, everyone wants to go to the Outer Banks. Everyone wants to go to Eastern North Carolina. Is that something that you guys are, worried about? These vacationers coming. We just saw in South Carolina, Myrtle Beach, how people from Ohio came and then they left or they contracted COVID-19. So is that something that you're worried about as well?
Well, I think fortunately we're sort of a waypoint on the way to the beach. So people pass through Greenville, but Greenville's not necessarily a tourist area. So that's favorable for us from that perspective. Unfortunately, many of our folks do go to the beach. So the potential to, when you visit a tourist area, to acquire the infection and bring it back to Pitt County is possible. I wouldn't say that I'm worried about it. I think, again, there's capacity in the healthcare system to deal with that. We're seeing more and more of our cases are very mildly symptomatic or asymptomatic. So there may be some sense that, is this virus getting weaker? Maybe. There was a story in the news that it was. There was also a story in the news that it wasn't, that it was getting stronger. So I'm not sure which one to believe on that, to be quite honest. But I think the more that people move around, yes, the more likely we are to see some cases. Could we see some cases imported to Pitt County for people who travel to Myrtle Beach or Florida or the Outer Banks or Atlantic Beach? Sure. but I also know people are very, people I think have some COVID fatigue at this point and want to get out, have some sunshine, and have some fun.
So recently we've had several new deaths from COVID here in Pitt County. We're up to 6, I believe, 4 in the past few days. I know you can go into detail about the specific people, but talk to me about why, essentially. Is this because of the conditions that the underlying conditions that they had, or what? Because I feel like for the longest time we only had 2 deaths.
Yeah, we did, Tyler. You know, for the longest time we had only 2, and I, you know, was very thankful that that number was so low. And first, let me say I'd like to extend my deepest condolences to the families on the loss of their loved ones. 5 of the 6 individuals who have passed from COVID-19 were over the age of 65. 1 is less than the age of 65. All of them had significant comorbidities, including heart disease, diabetes, high blood pressure, you know, which are kind of that's the deadly trifecta with COVID. You know, if you have underlying heart disease, if you have high blood pressure, if you have diabetes, that seems to put you at very, very high risk for a bad outcome with COVID. At least one of the individuals had some kidney disease on top of it. So again, when you take a person who is already stressed by these disease processes and then add a serious infection on top of it, eventually you hit a point where our body just can't recover from that.
And through a lot of these cases that we're getting outside of the nursing home facilities and care facilities, is it all primarily through contact tracing? Is it through community spread, or is it from people who left Greenville and then are Pitt County and then come back with COVID? Is there any kind of insight towards that?
We believe that that's mostly community spread. We're doing more and more of this sort of contact investigation and contact testing. And it's funny, Tyler, I think I've said this to you all before, with some of these contact traces, even within a house, we'll find that if one family member's got it, they've all got it. And then sometimes we find houses where one family member has it and nobody else has it. So sometimes even in a household, it doesn't seem to move as easily as we had once thought, and that's also a good thing. But yeah, most of these would appear to be community transmission, and there's been some talk. Well, they're also a younger demographic, and the biggest, when you look at the state data, if you look at the county data, I think the biggest group is that 25 to 49-year-old group. And those were also many of those folks who may have been in non-essential jobs, who were during the shutdown and stay-at-home order, were people who were staying at home, and now they're back at work. They're back out, you know, doing things in the community. So that may explain some of the spread in that age group. Fortunately, that age group is also at relatively low risk for a bad outcome from COVID-19. If you take the case fatality rate, our deaths over cases. So if you take our 6 deaths and divide that by 591, you basically come up with a 1% case fatality rate right now, which is slightly more than flu. If you believe some of the speculation out there that perhaps 10% of the population has already had that, if you redo that calculation saying, well, 10% more of Pitt County's had this than we can measure, then that takes that case fatality rate down to 0.031%. So down not much above flu, which is usually about 0.2, I think, 0.25, you know, usually less, a fractional percentage. So it's been out there, and the cases in that age group are far less likely to have a severe outcome than older cases.
Gotcha. 2 more just quick questions, and then I'll be done. How are you all, health department, working with some of these care facilities that are seeing some of the outbreaks? What are you all doing to kind of help mitigate that and, I guess, reduce it from spreading more?
So internally, once a case is identified in the nursing home, depending on how that facility is laid out and how staff circulate in the nursing home, the staff that surface that wing and the patients in that wing may be tested, or they may go ahead and test the whole facility. In most places, they've gone ahead and tested the whole facility. And again, this is where we found a number of these cases have been asymptomatic in that facility. One of the outbreaks we uncovered last week involved patients being transferred to other facilities who had no symptoms but were tested in preparation for that transfer and found to be positive. And, so when you find that tip of the iceberg, you try to expose the rest of it and get an idea how big that is. And you test the rest of the patients in that wing or that facility, as well as the caregivers. The nursing homes themselves have been pretty much on lockdown since it started, so no external visitors. So it's likely that a staff member brought that into the facility with them. And one of the things that we're finding is that some staff members work from one facility to another facility. They may not just work at one of these long-term care facilities. They may bounce around a little bit. So.
And just a final question here for me. We're about less than 2 months out from, essentially 30,000 new folks coming in to Greenville with ECU. And is there anything that you're doing to prepare for that? Or are you working with administration at ECU and with the city about navigating 30,000 new folks into the city with the possibility of bringing COVID this way?
Well, hopefully they don't bring it this way, but ECU, the students returning, does give us some angst. The number one county that the students come from is Wake County, very busy place for COVID-19. Forget what the number 2 county is, but it's one of the triangle counties. The number 3 county for students at ECU is Mecklenburg County, another high COVID place. So you could look at that 2 ways. One is that maybe these folks have already had it since they've basically been home since March, and we've suggested that maybe the university at least offer some serosurveillance to incoming students to see how many of the students coming back have actually already had the infection. We've met with several different groups at ECU to work on their plans and help them with planning for the return of students, including the very top. I met with, I guess he's interim Chancellor Mitchelson, Dr. Mitchelson this week. We're on a first name basis now. And so meeting with Ron Mitchelson this week and talking about the students and how we might be able to use some of their public health students in our department to help with contact tracing. And we're working with them to develop an internship so that we can onboard those ECU students and use them as part of our contact tracking and tracing team to help with management of the students. They are also working to have apartments available off campus where they can isolate and quarantine students who need isolation or quarantine. And again, let me just clarify for the record, quarantine is the separation of those who are exposed and believed to be at risk for the disease but do not have the disease. And isolation is the separation of cases or those strongly suspected of being infected with the disease from the population.
Thank you for your time. Appreciate it.
You're welcome, Tyler. Nice to see you in person again.
Good to see you too.
In a lot of places, we're seeing case numbers in younger populations rise. Why do you think that is?
I think some of it is the invincibility of youth. So again, that 25 to 49-year-old demographic, I think the younger end of that, these folks figure, hey, I'm not going to get it, or if I get it, it's not going to be that bad. So as with anything in public health, it goes back to perceived risk. So if you're younger and healthier, I think the perceived risk is low, and people may be less likely to take protective actions like wearing a mask, like staying away from people, and like washing your hands frequently. And I would mention to your audiences that we're well over 6 feet apart here, so I don't have my mask on at the moment because of that, but I appreciate you all wearing yours. So I think that's part of it. Again, I think that group is also, many of those folks were probably not essential workers who may have stayed home during the stay-at-home order, and as that has been loosened, have been out and mixing and mingling more and allowing for transmission. We also, we want to encourage people to socialize responsibly. I'm going to blot my chin because I'm sweating with no air conditioning. And we've seen some cases where it wasn't necessarily transmitted in the work environment, but folks from work got together and had parties after work with people who weren't in that work bubble, and then that person who came in that wasn't in the normal work bubble brought the infection with them. So as these bubbles of folks who have kind of been together throughout this time start to intermix, there will be some cross infection there.
You touched on this a little bit earlier, but are you concerned at all about the rising case numbers in Pitt County?
Oh, absolutely. I wish we never had a case at all, but unfortunately we knew this was going to be here. We know that virtually 100% of the population, at least at the start of this, was potentially susceptible to this infection. The numbers going up. I think overall, like I said, I think the burden of disease is probably stable in the county. That total case count is always going to go up because we don't take cases out of it. So when you look at it on a day-to-day case, you'll see from when we first identified the the original case back in March, you'll see day by day that case count has gone up, and now we're in that range where we're getting 8 to 12 cases a day. Where earlier in this we were in sort of that 4 to 6 cases a day. So the rate that cases is coming in has gone up, but we've also broadened the testing definition greatly so that almost anybody can be tested now. And we're testing a larger proportion of our population, so we're going to identify folks. The other thing too, and this may be hard to conceptualize, but people who have been infected and didn't have symptoms or had mild symptoms, if we test them, are we catching them in the convalescent phase of that illness where they're still shedding virus but they're not actively infected? Does that make sense? So we know that some people, when they've had the infection, if we test them on a day-by-day basis, sometimes for several weeks after they've had the infection, they continue to shed virus. So as we go out and we sample more people, are we really catching those folks who have the acute infection, or are we catching some folks, and it probably is a small percentage of them, that are in that persistent shedder group for the virus?
Governor Cooper is going to have a press conference in a little bit, and people are expecting that he might announce whether or not we can move into phase 3 on Friday. If and when we can move into phase 3, what is your advice to the people of Pitt County to continue to stay safe?
I would continue to be mindful of your social distancing, especially when you're around folks that you're not normally around. I do encourage and would encourage people to wear masks in public still. Again, it probably offers limited protection to you as the wearer, but if you have the infection, it greatly decreases your ability to spread the infection. And again, hand sanitization, hand washing, very, very important. When these measures went into effect in the end of March, we saw the flu rate drop off dramatically. It dropped like a stone because flu is transmitted in the same way as COVID-19. And we saw the flu surveillance curve almost, which had started to kind of build that spring wave. I know we've talked about that before, and we've shown that graphic where it went almost vertically down after these measures went into place and dropped off very dramatically. So, you're welcome.
Back to the governor's order. So how is the health department preparing for what might be announced today, and have you heard anything about what might be announced today?
I wish I could tell you we had a heads up. We don't. We have not received any heads up about what the governor is going to announce at 3 o'clock. For us, it's still recording cases, finding cases. We're working to get our testing program stood up, which will stand up just after 4th of July, so that we can do some active surveillance. We're also looking at how can we do some of that serosurveillance. The hospital has a great platform here to do some of that serologic testing. We're hoping that at some point we may be able to switch from acute testing to serologic testing, or to include that as part of the testing we do, and try to identify the real footprint of the disease in our community. So I'm not sure what the governor's going to announce at this point. There's been some speculation about a mandate to wear face masks in public. We're not sure if that's going to happen, that there's mixed uptake of that across the state. Some of the city areas, there's a couple of cities in North Carolina that have issued face masking requirements as part of their emergency authority. There was not sure that there's an appetite in Pitt County for that right now. If the governor were to make that part of his emergency declaration, we would be required to follow that as part of the law.
And if the governor does make wearing masks part of his declaration, who would have to enforce that in Pitt County?
As with any part of the governor's order, the enforcement falls to local law enforcement. So it would fall to the sheriff's department or Greenville PD or whatever municipality's police department to enforce that.
And as we've had a case increase recently, with people traveling for Father's Day recently, has that had any increase on the case count recently here? Have you seen that yet?
That'd be hard to say. Father's Day was only this past Sunday, so the bump with most of that, if you think most people get sick in the first 3 days, we might see some of that, but then testing and turnaround, there's a lag time in the turnaround, so we might see a little bit of a bump, 5 to 7 days down the road. The full exposure from Father's Day would be 2 weeks. Hopefully people socialized responsibly on Father's Day and didn't infect their dads. My family's kind of in a bubble, so for the most part, we have some outside contacts, but hopefully nobody infected me on Father's Day.
And as many people have plans to travel for 4th of July, the next holiday, what do you recommend for them as they go?
Again, I would encourage people to celebrate responsibly. If you are going to go to fireworks, keep your family group together. Stay at least 6 feet away from other groups. If you're going to be in a public gathering like that, I would encourage the wearing of masks. I would take some hand sanitizer with me and have that available. If I wasn't near someplace where I could wash up with regular soap and water. And I would avoid large gatherings where I couldn't do that.
And as we've had an almost 100 case increase in the past week, can you kind of give your perspective on that?
Mm-hmm. Again, I think a lot of that is due to increased testing. We have had some additional outbreaks discovered in nursing homes where we'll go in and in those groups we literally test everybody in that nursing home. So it's staff and it's patients. And a number of those cases that we're identifying are asymptomatic cases. So that's sort of that daily bump in there. I think when you look at the long-term indicators, in terms of our percent positivity, I've got that at about 7% to 8%. The state says we're at 5%, but they have more negatives than I do. So overall, I think even though we've counted more cases recently, I think the burden of disease in the community is still about the same, and we're just doing a better job of identifying and finding these cases through increased testing.
Okay. And at this time, are there demographics for the people that have the virus in the county, such as age, race, gender?
So the biggest group is that 25 to 49-year-old group. Excuse me. When I've looked at our data from a racial standpoint, I did this and presented this to the commissioners a couple of meetings ago for them. And in Pitt County, a little over 55% of our cases were amongst African Americans. A little over 13% of our cases were among white Hispanic individuals. So there's there's definitely a disparity there. African Americans represent about 31% of the Pitt County population, so their case count is 24% higher than what their representation is in the community as a percentage. The Hispanics, I guess, represent about 6% of our population in Pitt County, and they're a little over twice that at 13% in our case count.
And do you know a number at this time about the 25 to 49 age range, how many people that is in the county?
Not off the top of my head. We can get that information for you. But that is the largest group in terms of positive cases. That's true in the state data too, that the 25 to 49, or they may go 29 to 50 in their graph, is the largest group. But then when you look at deaths, it's heavily skewed to older ages, with 75 and older, and then 65 and older, and then much lower rates below that.
And when it comes to tracing, how many tracers do we have in the county, and has the state provided any tracers for the county?
Right now we have 7 dedicated staff in the health department that are working on contact investigation, contact tracing. We plan to bring in some of those ECU students once they finish their training as interns to help with that. That may be as many as 20 in that group, not necessarily 20 every day, but in rotation. We have a call this afternoon with the regional representative for the state contact tracing initiative to talk about what staff they might be able to provide for us.
And at this time, are you able to keep up with tracing in the county?
It's a battle. One of the things we struggle with is sometimes getting folks to answer the call. And so we would ask that if you see that 902-2300 number, which is the health department main number, come up in your phone, to please answer that. I know there's some scams out there about contact tracing. Our staff would call from that number, a health department number, and would identify themselves as Pitt County Health Department staff.
Thank you.
You're welcome. Anything else, guys?
Thank you so much.
All right. Thank you all.